And of course, we trust hospitals to make us well, right? What we don't expect is to get sick in a hospital, but every year about 648,000 hospital patients develop infections during their stay, and about 75,000 die. Consumer Reports' latest research finds that while some hospitals have been successful at cutting their infection rates, many have not. Jennifer Krause explains in today's Consumer Matters.
Kelly Pearson had heart surgery in April. Although the surgery went well, during recovery she developed a serious bacterial infection called C. diff.
It was incredibly painful. The second day I told my husband, I think I'm going to die.
Infections like Kelly's can spread from patient to patient within a hospital. Some of the most threatening infections are caused by C. diff and MRSA bacteria that can live on surfaces for days and pass from hand to hand. And MRSA is resistant to some antibiotics.
We analyzed hospital-acquired infections data for thousands of hospitals across the United States, and we rated hospitals based on how well they did at avoiding MRSA and C. diff infections. And the results were sobering.
Only 6% received top scores for preventing both infections, with some well-known hospitals having low ratings, including the Cleveland Clinic, Johns Hopkins Hospital, and Mount Sinai Hospital. To prevent these infections, hospitals and hospital staff must pay close attention to cleanliness. Also essential is to avoid the overuse and misuse of antibiotics, which can wipe out patients' good bacteria and let bad bacteria like C. diff run wild.
We know that most infections are preventable. And if hospitals committed to deploying evidence-based practices that reduce infections, then tens of thousands of lives could be saved each year.
Some hospitals are able to keep their infection rates low. The best prevent infections by designating special staff to oversee the use of antibiotics and by following clear protocols on cleanliness. Jennifer Krause, News Channel 5 HD.